Hello everyone, my name is Ingrid Morales and I hope you're having a good day so far. Today I'm going to talk about the violent teen behaviors associated with social pressures and compliance. So, what is the problem at hand? Well, roughly 16% of American high school students report being in physically violent fights. And although this may seem like a small percentage, the total number is about the same as the population of Kansas. And when I found the statistic out, I immediately knew that I needed to focus on violent behaviors because there is no way that we had a whole state population of students being involved in violent behaviors. And I also wanted to focus on it because I wanted to research other factors that affected students. And I wanted to know why some students were more likely than others to become violent. Now, I want to cover some definitions before we begin with all the data. The first definition is risk factors, which is just any type of behavior or pattern of behavior that can increase the likelihood of an individual developing a disorder or syndrome. The next is violent behavior, which is any contact, verbal and nonverbal, which can cause a reasonable person to fear another person or group. My investigation focused on how peer pressure in the last 20 years affected violent behaviors in American high school students. I found that peer pressure has negatively affected American high school students in the last 20 years, but I also know that it is not the only risk factor we need to focus on. We need to look at things such as mental disorders, parents, and environments as a whole, because this violence in students is not decreasing, and society needs to come together to do something about it. My research's main focus at the beginning was peers. I wanted to know how peers affected students. Now, one of the myths that I want to cross off right from the start is that students who are loners or insecure are much more likely to succumb to peer pressure. Now, through this peer-reviewed scientific journal called The Social Behavior and Personality, I found that it was actually popular students who succumbed to peer pressure most of the time because they wanted to uphold their social status. I wanted to know what gender and peer group affected a student the most, and I found that it was actually the best friend. Now, in regards to gender, I found through a study published by Gale that focused on male drivers and their chances of getting in a car accident because of risky driving caused by passengers, either male or female, that it was actually male passengers who increased the risk. When they had male passengers, the increase of risk of getting into a car accident was tremendous. However, when they had a female passenger, that risk was significantly decreased and sometimes it was completely eradicated. I also found through our AP stimulus materials that students actually stay with their opinions 65% of the time, and it is only that 35% of the time that they are more influenced by peers and negative behaviors than by parents. Moving on to mental disorders, this was one of the biggest factors, and I say biggest because much of the literature in this topic deals with mental disorders. This factor was the one that actually made me look at other factors that affected violent students rather than just peers. Now, associations such as the American Psychological Association and the American Academy of Child and Adolescent Psychiatry emphasize the importance of mental disorders in creating violent students. Now, one of the most emphasized mental disorders was depression, which is an unusual or extended feeling of sadness. And this is the most important because it can cause a student to feel very isolated, and this can lower their self-esteem and cause them to get angry, hostile, or irritable much faster. The two others that were mentioned the most was bipolar disorder and explosive behavior. Because of the frustration between bipolar disorders, students choose violence to let that anger out and to let that frustration out. Explosive behavior, on the other hand, is just aggressiveness. Students can get angry faster and any little thing can tick them off and they want to lash it out on any object. Moving on to parents. There was an article that I read called The Biological, Environmental, and Social Factors That Create Violent Students, and it focused on the effect parents had on a student throughout their development. Now, a child is not born with the necessary skills to express their feelings, and usually when they are overwhelmed, they will use violence, like slapping or throwing a toy across the room. And now, this is just how children cope. And it is important to understand that kids copy what adults do. Everyone knows not to say bad words near kids because they're like a sponge and they will absorb everything. And so it is important that parents are teaching their children the right tools and mechanisms they can use in case of a problem. Children need to have a safe space where they are taught what is right and what is wrong. And it is essential that when they do something right, they are rewarded. And when they do something wrong, they are explained as to why that is wrong behavior and why they cannot do it any longer. Something super important to know is that children need praise. Praise helps build up the confidence and it helps them form bonds with people such as mentors and role models. And it helps them accept that sometimes they might need help with some problems that they can't face alone. and they need to go ask help, and it isn't bad to go ask for help instead of just leaving it all in and getting frustrated with itself and then using violence as a way to cope. Next is the environment, and through an article titled The Cultural Evolutionary Trade-Off of Ritualistic Synchrony, I found the good and the bad of synchrony. Obviously, synchrony can be very good as it can help build communities and help communities bond and get closer through shared events and experiences. However, it can also be very bad, as it can cause a student to follow a command even when they don't necessarily agree with it, or when they know it's a very aggressive thing that goes against their beliefs. The most important environment for a student other than their home is the school. Students spend 12 to 14 years in school, depending on whether they start at pre-K or kinder, and even longer if they start at early childhood education programs such as Head Start. Now, educators need to realize that they play a vital role just as parents do in a child's life. Students need a safe environment where they can grow. They need to be able to make mistakes and learn from those mistakes. And schools need to start taking a more proactive approach to violence through special programs dedicated to educators and parents. One of these programs is called the Triple P program, and it teaches skills to parents while a student is developing, and it has shown to improve communication skills and tremendously decrease violent students. The Triple P program is called Triple P because it is a positive parenting program, and it is one of the most effective evidence-based parenting programs in the world, backed up by more than 35 years of ongoing research. Triple P gives parents simple and practical strategies to help them build strong, healthy relationships and confidently manage their children's behavior and prevent problems with their development. Triple P is used in more than 30 countries and has been shown to work across cultures, socioeconomic groups, and many different kinds of family structures. Triple P is delivered to parents of children up to 12 years old, but there is also a Teen Triple P program that is delivered to parents of children from the ages of 12 to 16 years of age. Through my research, I have compiled these 9 risk factors for a teen at risk. The first factors include being males, between the ages of 11 through 18, with the fascination of weapons or killing. These students can have problems with authority and or drug and alcohol abuse. They can be cruel to animals and have excessive stress in the home, and of course, have issues with depression. Moving on to some counterclaims or other perspectives. Of course, it is important to understand that just because a student checks off risk factors does not mean that that student will become violent. Just because a student is male between the ages of 11 through 18 with a fascination for weapons or maybe drug abuse, that does not mean that that child will become violent or choose violent behaviors in the future. And the same goes to students who do not check off any risk factors. Just because they do not check off anything, maybe they're female, maybe they're 10, maybe they don't have depression or excessive stress in the home, that doesn't mean that they will not choose to be violent in the future. This basic profile is just so educators can realize teens at risk and can offer them help. The next and most used counter-argument is money. To implement programs such as the Triple P program, it's very expensive, and to do it nationwide, it's even more expensive. And opponents do not think that if they put in that money, it will yield the results that they want. And to that, I would just say that helping students understand their feelings and learn communication skills will greatly benefit in the future. And if you start doing this from a young age, there will be no necessity for reactive approaches. This is what happens after a student is violent, after a student chooses to get in a physical fight, after a student chooses to commit suicide, after a student chooses to shoot up a school. There isn't no what happens then, because you are taking a proactive approach to decrease these incidents. Of course, we do not live in a perfect world, and sometimes we will have to react to violent students. And when this does happen, we need to take away the one-size-fits-all solution. Each student chooses to be violent for a different reason, and we need to take the mentality away of everyone is the same and every solution will work in the long term. Patient A may choose to be violent because of a traumatic event that happened at school, while patient B may choose to be violent because of family issues or dealing with mental disorders. These two patients may come from different socioeconomic and racial backgrounds, and we need to realize that this solution for patient A will not work with patient B, and this solution for patient B may not work for patient A. They may be similar, but they're unique in their own way to help each patient. The next thing we should focus on is educators and parents, and What I mean by that is they should focus on cooperation and resolution skills from a young age to prevent those students from being violent in their teen and adult years. Lastly, we need to implement programs that take a proactive approach to violence, such as the Triple P program, because this can help completely eradicate the need for a reactive approach. Thank you. These are my citations.